Okay guys, now it's time to talk about acute stuff. Alright, so let's go through pneumonia. There's so many ways to classify it, don't worry about it, it's super easy. So basically you can get it from anything. You can get it from a fungus, a bacteria, aspiration, breathing something in, anything like that. So it's acute inflammation, and there's two physical types. One is broncho, so that means that it's patchy all around. Not all of the alveoli in that lobe are being affected. And then there's lobar, so that means it's a very big continuous area. And so all of the alveoli in that area will be affected. Okay, there's other ways to think about it too. So you've got your 4 different kinds of where you can get it from. So there's community, so you get it from people in the community. And then there's nosocomial, which I like to think of it as saying no to the community because you get it from the hospital. So you think you're going to the hospital to be protected, but you actually get pneumonia there. So nosocomial, no to the community, but then you get it anyways. So, something about mechanical ventilation, a lot of those people really get it. You get it in the ICU because in order to have that mechanical ventilation inside, it needs to be super sterilized. The hands need to be sterilized. Everything needs to be sterilized. And if there's one little piece of crap in there, you're going to get pneumonia. So the other type is aspiration pneumonia. So you aspire to be something great, but then you end up breathing something in and you become something terrible because you get pneumonia. So you breathe some kind of vomit or something into your lungs. So on a side note, you can breathe that into your lungs and get pneumonia, which is like a lot of acute inflammation and some edema and stuff like that. But if it's like a peanut or something that's not going to dissolve, what happens is Donald Trump comes in, he builds a wall around it, and then you have an abscess. So that was like, we don't want it. We're going to keep it all in that corner, and then that corner becomes like a big pussy pile of mess. So that's not cool. The way you diagnose abscess is you can look at it on an x-ray or you can take a needle biopsy. You feel chest pain and you have purulent sputum if it gets out of that wall. But back to pneumonia. The other kind that you can have is opportunistic. So it's like you get really weird viruses and stuff coming in. So it's people who have HIV or something like that with compromised immune systems. And so it's like the little guys are just waiting there. They're just waiting for that opportunity when they're really low just to come in and they get you. Okay, so then it can manifest in 2 separate ways. It can be typical or atypical. So typical, you have lots of coughing, you hear the crackles, you can see it on an x-ray, very easy to diagnose. Or you can have the other kind like I had, which was mycoplasma, and that's atypical. So you have no symptoms, you have no crackles, you have a normal x-ray, you're just walking around, you feel like crap, you start to get asthma, you can't breathe, but nobody knows what's wrong with you. So hopefully, if you're lucky like me, you get it diagnosed after a year and then you get better. Yes, so usually you can check it by a blood test, so that's how I got checked. They can, if the x-ray and the crackles doesn't work, they can give you a blood test and find out. Pneumonia can lead to emphysema, so all the alveoli break down, or ARDS, or an abscess. So let's go on to 2 types of fluid in the lungs, pulmonary edema or pleural effusion. So 2 of the same things, different spots. Pleural effusion is in the pleural space, so there's only supposed to be a little bit of liquid there, and it's not really a space, but it becomes a space when too much of that liquid is there. So this comes, so you have 2 types of liquid, exudate or transudate. They both come from different things. Transudate is a thin, clear stuff that has no inflammation. It comes from a heart failure, leakage from the visceral pleura. Then the other one, exudate, is thick plus inflammation, really disgusting, from infections or cancer. So you can see a trend here. Anything that's thick and pussy and disgusting comes from infections usually. So if it's exudate, you're going to hear that pleural rub, that leathery sound when you auscultate, or you're going to have pain in your chest. And then on both transudate and exudate, you're going to have absent breath sounds. Okay, atelectasis is when the alveoli or the lung collapses. So this can happen from compression. So let's say you have an abscess there, compressing that area, then it might collapse. You can have a problem with alveolar gas absorption. Don't ask me about that one, okay? I can't give everything to you guys. Surfactant impairment. So in the alveoli, you have to have some liquid for the gas to go through, or else gas exchange cannot happen. So that liquid in there, if there's no surfactant, it becomes like little droplets, and then the surface area is gone to heck. So you need that surfactant to keep the liquid even. So if it's not even and gas exchange isn't happening very well, then eventually it just gives out and they're like, forget it, and they collapse. Diaphragmatic dysfunction. If your diaphragm isn't creating enough pressure in and out, and you're not getting a super deep breath into the bottom of your lungs, and then you can get basal lobe atelectasis. So they just give up because they're not being used. Anything that's not being used can end up giving up. So you can see this by no breath sounds, and tachypnea, which is increased breathing. And the mediastinal shift is towards the affected side. So if you have lots of effusion, the sternum shifts to the other side. If you have less stuff going on there, it shifts this way. Okay, finally we have ARDS, which is trouble getting the air in. Like a lot of these things are, it's an acute respiratory problem. You're pretty much screwed if you get this. It happens 24 to 48 hours after these other problems come on. So it's basically caused by any of those initial insults that I just mentioned, pneumonia, edema, effusion, stuff like that, and you basically get all of them at the very same time. You get fibrosis, you get damage to the capillaries, the alveoli start to shut down, you get edema everywhere, and so you can die really easily with that. And if you look on an x-ray, you just see a bilateral whiteout, so that's how they know that's happening. So that's acute respiratory distress syndrome, I think ARDS. All right, that's it.